Hi, everybody, and good evening. Welcome to the Finding You podcast. I'm Dr. Brad Reedy. Today is Tuesday, June 30th, 2026. So tonight is one of my all-time favorite topics, not just to speak on during the podcast, but also to think about, to talk about as I'm working with clients. And I would argue that as I work with clients, I'm always thinking about the narcissistic wound and how it shows up in the patterns of our behavior with our defenses and so forth. So I'm going to be expanding and expounding on that this evening as I go through it. Before I get into that, let me talk about our upcoming items, our upcoming paperwork. Let's talk about our housekeeping items. So for those of you who want to engage and to participate in something that is a deep dive, a therapy accelerator, or a therapy jumping off point, if you're not quite sure what your work is, the Finding You Intensive is designed just for those purposes. It's an exploration of our history, of our family of origin patterns, kind of the soup that we were cooked in, and how that is contributing to the dilemmas that we find ourselves facing in life and in relationships today. So the next offering will be August 5th through 9th. It will sell out. That's August 5th through 9th. It's all inclusive. You just show up, we pick you up, we take you to our home in Midway, Utah, in a beautiful setting, and you engage with 6 other people in this kind of deep work. And it is I think maybe the most important part that I can tell you about it is it's safe. We use the word intensive because it's an immersive experience, but it is the safest experience, which of course, as I talk about and teach all the time, safety is the treatment, not something that we do just to get to the treatment. September 9th through 13th, after that, October 7th through 11th, we will also be hosting a couples Finding You later on this fall in November. So if you're interested in working with me specifically as a couple, if you want to do this work with a partner, you want to be a witness to their work, you want them to be a witness to your work, and I can find no greater example of the idea that I often share, that to have a long and happy marriage, we need to learn to fall in love with our partner's dilemma over and over again. This is an opportunity to do just that. For all other inquiries, for couples, for families, for private intensives, if you're looking to attend our support group, which is the third Wednesday of each month, the next one is July 15th, or if you're looking for a coach or a therapist who works in the same model that I teach, email us at info@findingyouprograms.com or reach out to us through our portal. If you haven't heard, the Finding You Inner Circle has launched. This is a subscription to the podcast, which also gives you access to a couple of episodes a month that you won't get otherwise. And also, it is an opportunity to attend all of these broadcasts live so you can interact with me. So if you're interested in that, check that out. Looking forward to that. If you want to learn more about my work, you can read one of my 3 books, The Journey of the Heroic Parent, The Audacity to Be You, and of course, Stay in the Room, my most recently released book, which I co-authored with Michael and Jeff McLean about a Mormon family and how they did their work to find each other. And I think it's an incredible opportunity for everybody to read. So if you want to learn about that, check that out. I will be in Rhinebeck, New York this summer, just in a couple of weeks, at the Omega Institute in the Hudson Valley, just outside of the city, a couple of hours. That's July 12th through 17th. My daughter Emma and I will be repeating our course, The Audacity to Be You, Learning to Love Your Horrible, Rotten Self. It is a wonderful and beautiful setting. It's 5 days. It's very affordable. Around $500. You have to add your own lodging to that. You can either stay on site or find your own lodging. So if you're interested in that, go to the Omega website at eomega.org. That's eomega.org. And I'll be teaching this same class, leading the same class in the fall at the Art of Living Retreat Center in Boone, North Carolina. So if you're interested, if that timing works out for you or that location works out for you, September 27th through October 2nd, Emma and I will be teaching, facilitating that course. To look for that, to register for that, go to their website at artoflivingretreatcenter.org. That's artoflivingretreatcenter.org. And look forward to seeing you there. With that, let's get into tonight's topic about the narcissistic wound and narcissistic patterns, narcissistic diagnosis. First of all, I want to explain that the narcissistic wound is something that everybody suffers from, even if it's not a lot, just a little bit. Everybody has this experience. Essentially, the narcissistic wound, broadly speaking, is the injury that occurs when a child's authentic self isn't mirrored, attuned to, or allowed. And in its place, the false self develops a secure connection to ensure approval, safety, and that they won't be abandoned. So the narcissistic wound is the human limitations of our parents and their ability to connect and to attune to us. So when I think about, and I'll get to the idea of treatment a little bit later on, when I think about treatment for the narcissistic wound, I think about psychotherapy and how therapy becomes the childhood that you did not have and the therapist becomes the parent you did not have. People ask me all the time, how does it get done? How do you do this healing work? And essentially, it is to experience something quite different than the narcissistic wound. It is to find somebody that can attune to you, who's interested in finding you, understanding you, rather than fixing you or changing you or improving you. It is sitting in the presence of an empathic, patient, and non-judgmental other who learns to see and appreciate all of you, not just the bright and shiny, pretty and smart parts, but all of you. So where our parents bumped up against their own limitations and were unable to hold space for us to see us, and by the way, every parent, including all of us listening, if we are parents, every parent will find the edge of their limitations. So I know these words are big words. Words like narcissism and the narcissistic wound seem like very large, pathogenic descriptions of the human condition, but it's just the condition that all of us, to a greater or lesser extent, suffer from. And the narcissistic wound, that wound of not being seen and loved as you are, held as you are, which leads to ultimately this idea that we need to be something, produce something, look like something, achieve or accomplish something to gain love, to earn our love, to earn our worthiness and our belonging. That dilemma that I'm describing is what really everybody in some level suffers from and what contributes to the defense. Very simply and broadly put, you can understand that the defense, any of our defenses, are essentially aimed at protecting against this wound, that we are not good enough, that we are not lovable enough. If you grew up in a family, let's say, that was farther along on the continuum of this being able to see and hold space for you and attune to you, you would know that even the dented, the wounded, the limping, the imperfect parts of you were acceptable. They weren't so much that your parents were upset, frustrated, disappointed, angry, anxious, and eager to change you. You would see that those parts of you are acceptable. And so when you made a mistake in the world, when you came up short, as everybody does, and somebody pointed that out, you would be able to, on a more regular or consistent basis, be able to own that part. To be able to see that, yes, in fact, I did make a mistake. Yes, I did hurt you. Yes, I was scared. And in protection of that fear or that defense, I gaslit you. I hurt you. I accused you of being the problem. So the narcissistic wound is something that everybody has some of. And simply put, it is essentially understood in a simple kind of concrete way as the defense. The defense that I have to be good or right or worthy to gain your connection, to gain your attention, your proximity. The wound is the narcissistic injury, a lack of connection and attachment in childhood. Narcissism, when we talk about that a little bit later, and I'll talk about that in detail, narcissism doesn't always come or manifest itself in the arrogant, grandiose form. Sometimes it looks depressed and anxious. It looks like low or poor esteem. This more deflated, depressed version, sometimes called covert version of narcissism, isn't inflated, but rather self-deprecating. This type of narcissism still has with it a quality of self-centeredness. With the deflated or the depressed or the covert narcissist, it's always about, I'm the problem. And a lot of you will recognize this in yourself. You'll find that when somebody's talking off in the corner of a room, you might have that anxiousness that maybe they're talking about me. When somebody doesn't show up to an event that you planned, you'll be more inclined with this narcissistic wounding and pattern to take it personally. So this type of narcissism, like I said, is still positing the individual at the center. And what they look for is the individual looks for evidence that the world is pointing to them as in some way detestable, the problem, the reason for somebody else's upsetness, rage, anger, judgment. They find a way to blame themselves for what others think and do. Right? This starts to sound like codependency, doesn't it? This style of narcissism often triggers others to respond with compensating behaviors. For example, enabling or rescuing behavior. So the narcissistic wound is what's under it. The narcissistic injury is what's under it. And the way that it manifests, the way that it presents itself in the world can look either grandiose or deflated and covert. So when we talk about the narcissistic wound and think about it in terms of developmental psychology, this wound forms when a caregiver can't tolerate or reflect back the child's spontaneous, authentic experience. This is what Winnicott called the true self. The child learns often pre-verbally that being fully themselves doesn't quite get met, doesn't pass the test. So they build a false self, organize around getting these needs met where they weren't met. Performance, achievement, caretaking, perfectionism, charm, etc. Kohut frames it as a failure of mirroring and idealizing functions. The parent couldn't be the admiring mirror or the calm, capable other the child needed to internalize a stable sense of self-worth. The grandiosity or compensatory self-importance we associate with narcissism is not the wound itself. It's the scar tissue. It's the defense against this wound. It is what covers it up. When we think about Jungian or depth psychology, analytical psychology, this maps closely onto the persona versus shadow. The persona is the kind of suit, the costume we wear when we go out in public, right? I have a work persona. You have a work persona. You might even have a church or a grocery store persona. You might have a neighborhood persona. You might have a father, mother, parent persona. You might even have a persona in your family. It's what you wear, how you present yourself to the world in a way that you think or sense is going to be acceptable to them, something that will make sense, be palatable to them. The narcissistic wound is what happens when a child's persona, the adapted presentable self, has to do so much work that the authentic material gets exiled and shoved into the shadow. The grandiosity is compensatory. That's really important. The grandiosity of the narcissistic pattern is compensatory. So that adage that I've shared before, that every superiority complex covers up an inferiority complex, is this statement said another way. Underneath sits an unbearable sense of unworthiness or non-existence. Jung's not like Kohut here. Both see bluster as defense against the underlying void, not as the pathology itself. In attachment language, you could also frame the narcissistic wound as a derivative of insecure attachment. I've already kind of suggested that. Specifically, a strategy where the child suppresses the authentic affect or need, since expressing it didn't bring safety or connection, and substitutes a strategy of self-sufficiency, specialness, or invulnerability. It's an attachment adaptation that calcifies into identity. So narcissistic wounding will often look at life through this lens of, am I unique or special? How do I compare? Narcissistic wounding tends to be comparing. There's only a limited amount of love and affection and attention, and only the most special of us, of any of us, will get that love and attention. So narcissism and the narcissistic wound tends to compare, tends to see love and attention as a finite resource only afforded to the most unique, the most special among us. And second place is death. Second place is annihilation. Second place is nothing. The core experiential piece across all these three lenses is this. The wound isn't, I am too much or I am not enough exactly. It's closer to, I am not lovable as I am. So I must become someone who is. When I write about the narcissistic wound and narcissism, I explain over and over again, it's not about overvaluing the child. It's not about giving in to the child necessarily. It's not about, as some people, even more unaware of this process, might describe, it's not about loving a child too much or heaping too much praise on them. It is, in a way, loving the wrong thing in the child. And that is the good parts instead of the whole of the child. And again, everybody listening to me who has any experience at all with children will be able to sense in themselves the inevitable process of finding your limit. You don't have an unlimited energy, an unlimited capacity. And so you're going to come up short in your role to hold space for the child. The more consistent that failure is, the more substantial the wound. The greater you are to make a repair, the less substantial the wound. The less frequent it is, the less substantial the wound. So again, it's this continuum. Everything we call narcissistic behavior, grandiosity, contempt, need for admiration, fragility under criticism, is the defense built to protect a self that was never allowed to be ordinary, flawed, and still worthy of love. It is essentially the wound of not being seen. It can occur when parents are compromised in any way. Limited time, limited resources, energy, being stressed or overwhelmed, not knowing how to deal with a child that doesn't seem to naturally gravitate toward your sensibilities, right? We all have, if you have multiple children, you might sense that some come with a temperament that is more akin to yours, more relatable, less other than you. So the narcissistic wound is something that everybody experiences. And having been raised by human parents with limited resources, we all have some narcissistic wounding and we all have some narcissism. And this might be the best moment in this broadcast to mention all of the derision, all of the hate, all of the reactivity, all of the ink and the social media information that is written about the narcissistic personality. And really our energy around that is evidence of our own unexplored narcissistic wound. The more in touch one is with their narcissistic wound and how it manifests itself in patterns and relationships, the more compassion, the less triggered, the more understanding, the less we would take personally a narcissist's grandiosity towards or around us. We all have some of this. And while we are getting better in the world these days at not talking about mental health issues with contempt, narcissism is one of those diagnoses that we still give permission across the board to talk about with contempt. We make it normal and maybe even healthy, or at least acceptable, to hate the narcissist and their presentation. And understandably so, because like we do a lot with all of our defenses, grandiose narcissists or covert, depressed, deflated narcissists end up wounding us a lot. And so to deal with that wound, instead of grieving and feeling the pain and the sadness and the hurt that one would feel when they are wounded, we turn that into hate, into judgment, into anger and rage. We essentially other the narcissist. So when folks are talking about narcissism on the internet, when I read things about narcissists, I am sensing the amount of work that the person who's making the statement has done by the level of energy they have toward the narcissistic individual. So that's the narcissistic wound, the narcissistic injury. Now let's move into narcissism as a diagnosis. And to be clear, there are two ways that we think about narcissism. One is in this narcissistic wounded way that everybody experiences on a continuum to a greater or lesser extent. If a pattern of grandiosity or covert deflated narcissism becomes entrenched in a person, if that is their adaptation to defend against this wound of not being loved as you are, and it takes on this form that we call narcissism, then it deserves the diagnosis. But I don't care if you're talking about people that have substance use disorders, if you're talking about people that we talk about in pop psychology who have codependency, if you're talking about people that are depressed or anxious. We still pay attention to, as psychotherapists, as analytically trained psychotherapists, we still pay attention to the narcissistic wounding. because that is the barrier to treatment. If you have to be good to be loved, to be acceptable, which, by the way, being loved and acceptable is not just a preference. It's not just the icing on the cake. It is the cake. It's the eggs and the milk and the flour and the sugar. It's everything that went into it. So if you are suffering from the narcissistic wounding, therapy is going to be difficult. Because for the narcissistically injured person who doesn't have the experience that who they are is acceptable, the bad people have to be out there. The problem has to be out there. It can't be me. Because if it's me, it is a dreadful, dreadful idea. So let's go into the calcified pattern of narcissistic behavior to cover up the wound. Narcissistic personality disorder, according to the DSM-5, our latest manual that tells us how to diagnose people in the United States, is a pattern. It's a pattern of behavior, not a feeling. The criteria include that you have to have at least 5 of the possible 9 markers, which cover areas of grandiosity, fantasies of unlimited success and power, believing that one is special, or need for excessive admiration, a sense of entitlement, a pattern of exploiting other people interpersonally, a lack of empathy, an envy or jealousy as a theme, and of course, arrogance. So let me describe from the manual what the diagnostic criteria, 5 of which out of the 9, one has to meet to qualify for this diagnosis of narcissistic personality disorder. Number 1 is a grandiose or sense of self-importance. You will hear this in people's language. They will say things like, I'm the best at this. Everybody knows that I'm the best. I'm the greatest. Everybody agrees. And second place, again, is not just unacceptable. It is death. It is an unspoken dread to come in second. The second criteria, preoccupied with fantasies about success, power, brilliance, beauty, or ideal love. Again, the idea for the child inside the person suffering from this disorder. The child inside that is suffering feels like that's their only way to gain love. Their only way to fit in, their only way to live, to survive, to be of any worth whatsoever. So the preoccupation with this success and power is, again, a defense against this wound that who I am is not acceptable. Who I am is unlovable, detestable. The third criteria, believes he or she is special and unique and can only be understood by those that are with special qualities. So they have the experience that nobody will ever get me, nobody will ever understand me. And again, where does this idea come from? It comes from the fact that the big people around them couldn't see them. So the only thing that would garner the attention of the big people was something absolutely exceptional. It was the only thing that was allowed to be, in a manner of speaking. Criteria 4, requires excessive admiration. One thing I'll just note here as we're kind of halfway through these criteria is narcissistic patterns of behavior, the narcissistic personality disorder. I think one of the most challenging aspects of it, and I spoke about this a little bit earlier about how so many people are triggered and love to talk about narcissists with great contempt and disdain, is that it tends to make people feel small, less than. That gives you a clue to something I often teach about. When you're in the presence of somebody and you start to feel small or less than, you can ask yourself, is this a function of projective identification? Projective identification is more than projection. It's not just projecting onto other people an aspect of yourself, characteristics of yourself that are unconscious. But it's also kind of inducing in them a response With projection, you project onto people. With projective identification, it is said that you project into somebody. So, back to the point. If you're having that experience of feeling less than, small, dismissed by somebody's grandiose presence, what that shows you, I think this is actually beautiful, is it shows you what they're feeling. It shows you that those feelings of inadequacy, of less than, are actually coming from them. So one of the challenges with treating and supporting folks who suffer with this disorder is that they provoke a reaction in others that we want to knock them down to size. We want to make them feel small. We want to show them that they're not all that. We want to point out their flaws, to criticize. But of course, if the pattern has become calcified in the individual, none of that works. The psyche doesn't allow it. It dismisses it and finds a way to rewrite that story that you are telling where you are the inadequate one. There's a sense of entitlement. That's part of that special. And I think that's where people get confused, that they think that narcissists come from parents who are over-celebrating the child. And that's just not what it is. Again, it comes from parents that are celebrating the wrong things in the child. Just the good, bright, and shiny, successful parts. Not all of the child. Narcissistic personality disorder is interpersonally exploitive. Takes advantage of others to achieve goals. Again, the inadequacy is so dire and desperate that other people don't care. And because the narcissistic individual has been treated like an object, I think everybody's familiar with sexual objectification in culture. Anyone who's done a little bit of thinking or reading about self-help, psychology, pop psychology, you're familiar with that term, sexual objectification. We talk about it in the patriarchy, that there's an objectification of women. That's a very common thing. We don't talk about objectification in other areas of life as often. It's quite rare. But for people suffering from this injury, the objectification is you're turning me, my value, my worth is what I can achieve, what I can give to you, how many awards I have, how handsome, how fast I can run, how well I can sing, the grade that I get in my biology class. That's my worth. That's what seems to get the glow in my parents' eye, or the adult people in my life seem to give me the warmest attention and affection when I do those things. And when I point this out to families in a pattern, they'll often say, I just wanted them to be happy. I was just celebrating what they did. And on the surface, it might seem that way, but it feels much more substantial to the child, to the developing young child. Another criteria: lacks empathy and is unwilling to recognize what others are feeling and what their needs are. One of the things that my therapist told me years ago is that narcissists can't listen, especially when the topic is about their limitations and their humanness, their fallibility. So when you think about yourself as a parent or a partner, and you find yourself repeatedly defensive about what your family members think about you, what their experience of you is, you are bumping up against your narcissistic wounding. And again, if the pattern, if the defense is consistent and becomes solidified, calcified, it becomes the disorder. The 8th criteria is often, it says, people with NPD are often envious of others and believes that others are envious of them. Again, it's a competition. When somebody has this narcissistic wounding, I'm hearing comparisons constantly. And lastly, shows arrogant, haughty behaviors and attitude. Again, that tends to be the more classic, grandiose, inflated, overt narcissists, but it's listed as one of the 9. So to qualify for this diagnosis, you have to meet 5 of the 9. And we can all think of people in our lives that do meet 5 of the 9. But it is critical to remember. In fact, it's essential as part of your own mental health practice to not distance yourself too much from these folks. I've shared the story that when we are graduate students learning about the diagnostic manual, when we're learning about all these diagnoses, it is very common for a graduate student to see themselves in all of it. And and by the way, this happens almost invariably. Not to everybody, but it happens to a large percentage of students studying the diagnostic manual in graduate school. And so what happens is most professors will say, well, it's not you and it's less than that. What I would have loved my professors to say instead of that, to dismiss it, to distance me from that diagnosis, is to say, great job. You see yourself in them. That can give you more compassion for them. We all have a little bit of this. People with NPD meet the criteria. Their patterns are consistent enough. It could be said that that's their kind of skeletal structure. That's the core of who they are. That is their main style of adaptation to their childhood trauma. But the fact of the matter is, all of us have a little bit of that. I mean, everybody that I know has some defensiveness. And the defense essentially is the defense against the narcissistic wound. So the next time your partner, your spouse, your child, your friend, your coworker, your neighbor starts to say something, watch what comes up in your body. And what comes up on a conscious level, if you haven't done your work, is you start thinking about the ways in which they're wrong, about how you're not at fault, about how the problem does not lie in you. But the more work you've done, you can see some truth in it. Even with a made-up story, you can find some strands of truth. Notice what's missing from the list that I just described in the diagnostic manual. It's any reference to the inner experience. The diagnostic criteria describe the exoskeleton, the observable behavioral and interpersonal patterns, not the interior architecture that produces it. That's by design. DSM diagnosis is meant to be a behaviorally verifiable structure, not theory-laden. But it means the diagnosis describes the defense structure, not the wound underneath it. And probably of all the diagnoses that are out there that get talked about, narcissism is the most misrepresented in the literature. This is where Kohut becomes essential because he split narcissistic presentation into 2 phenotypes, 2 ways of presentations, and I've already alluded to those. The first is the grandiose or overt presentation of narcissism. This is the presentation that everybody thinks of when they think of the narcissist. Inflated self-regard, dominance, lack of apparent shame, etc. But also the vulnerable covert narcissist. Hypersensitivity, shame-proneness, social withdrawal, a self-concept that oscillates between secretly special and secretly worthless. It tends to look like the flavor of codependency that many of us are more familiar with. They still require a lot of energy. And initially, the response from the other is to try to buoy them up. But you learn over time that doesn't really land, that doesn't really stick because the soil, the base, isn't present. So the same underlying wound, the narcissistic wound, failed mirroring, a self that wasn't permitted to be ordinary and still valued as it was, but 2 different defensive architectures built on top of it. Overt narcissism defends by identifying with the grandiose compensatory self. Covert narcissism defends by hiding, terrified of being exposed as the deficient self underneath. Many clinicians now treat this as a spectrum or even oscillation within the same person, not 2 separate types. My own experience of my narcissistic wounding is I do tend to oscillate between self-importance, grandiosity, and absolute deflation. So now when I find myself thinking about how wonderful and special I am, I take a pause, I take a moment, I take a beat. And I wonder what wounding is being activated in me. Or conversely, when I find myself, and this just happened this weekend with my wife, I shared with her, it wasn't being demonstrated, I don't think, in any kind of overt way, but I told her over the weekend, we had some time alone, and I said, I'm feeling worthless lately, and I can't trace it to anything. So I spent a lot of time talking with her about different triggers, different experiences, what might be causing it, and how I was oscillating back and forth between inflation and deflation. This is a technical move worth making explicit. The wound is the developmental and near universal wound in some degree. The disorder is what happens when the defensive structure built over the wound becomes rigid, totalizing, and an identity level. Plenty of people carry a narcissistic wound. I would argue everybody to a greater or lesser extent. Some grandiosity, some need for admiration, some fragility under criticism, without it organizing their whole personality or harming the people around them. Narcissistic Personality Disorder, or NPD, is what you get when that defense isn't a strategy the person uses sometimes, but the only self that they have access to. So again, I hope more than anything that this particular broadcast will encourage and engender a capacity for compassion for others. And maybe even the courage to look at our own narcissism, our own narcissistic wounding. One of the barriers to looking at it is you've got to look at your family of origin, you've got to look at your parents. But you see, here's the real trick. If your parents were unconscious of their own narcissistic wounding, their own attachment fractures, their own experience of not being seen and loved as they are, attuned to as they are, then they can unconsciously pass on this pattern where you're responsible to think that your parents are great. I can't overstate this idea that I don't want to die with my children idealizing me. I want them to have some sense of my fallibility, the ways that I've hurt them, the ways that I've dented them. So if you find yourself being resistant to looking at your narcissistic wounding, which in some ways points to your family, to your parents, I might suggest that you have unconsciously been recruited in the service of your parents' narcissistic wounding. Because in my experience, when somebody is in touch, has done some work around their narcissistic wounding, they don't need other people to think they're great. Especially their children. Because the cost is, if the child doesn't know about your fallibility, about your limited capacity, about your pitfalls, about your mistakes, and you make a lot of them. We all do. So many that we can't count them. If the child can't see it in you, they will assume it's about them. And the chances of them developing a mental illness because mom and dad have to be good, the one thing that I have found that is consistent with virtually every dysfunctional family that I work with is this shared kind of task to keep the parents in the position of being good. So the narcissistic wound I wrote is a wound of not being seen. It might look like overvaluing, but it is not valuing the whole child or the real self of the child. And valuing the real self has little to do with a child's accomplishments, cooperation, talents, or pleasant behaviors to the parents. Many children with whom I express this sentiment, they equate their successes and subsequent parental responses as affection and love. Parents, anxious to be seen as loving parents, lather praise to prevent any possible dip in the child's self-esteem. But again, this dynamic essentially misses the child because the child is turned into a thing, to an object, a reflection of the parent, an extension of the parent, rather than being allowed to be their own person. I had this wonderful, I was doing a radio interview, a Sirius XM radio interview on the doctor's radio channel on Friday with my two co-authors of the book. And as we neared the end of the interview, the doctor doing the interview asked one of my co-authors, the father, he said, "Are you proud of your son that he's kind of taken up this musical gift that you had? Are you proud of him for that?" And I was very curious to hear what my co-author Michael said. And Michael started off by saying, "That's a tough one. That's a complicated question." And I was just happy that we started there. But then he went on to say something so poetically and beautifully that it reminded me about why I got involved in the project in the first place. He said to the interviewer, he said, in essence, "I'm proud of my son for who he's become in spite of me. In spite of who I told him to be or what I told him to be. That's the part of him that makes me most proud." And I can't think of anything more of a more helpful example to show what it looks like when somebody has done the work on their own narcissistic wounding, has taken responsibility for it, and is now able to offer the child a kind of love that is so much more transcendent than the kind that is attached to successes, accomplishments, parts of the child that the world loves. The diagnostic manual criteria of lacking empathy tends to get read as cruelty or coldness. Clinically, it's more accurate and more useful to describe it as the internal experience of another person's separate subjective reality is intolerable because it threatens a self that has no stable ground except being mirrored back as perfect. So if you get loved for the good things that you do, you have to be good. It's that simple. If your parents have a greater capacity, if they're larger than that, or the other big people around you are larger than that, are more conscious than that, then they'll meet your mistakes. They'll meet your failures. They'll meet your fallibility, your flaws, if you will, with grace, with compassion, with understanding, with empathy. Empathy requires a secure enough self to tolerate someone else's reality without it being a referendum on your own worth. If your self-structure is that precarious, someone else's pain, need, or disagreement isn't just inconvenient. It's essentially destabilizing. So it gets defended against, often via contempt, dismissal, or rage. Narcissism is not the result of being overvalued, what I wrote. Instead, narcissism is the result of valuing the wrong thing in the child, or valuing the child in the wrong way. To put it another way, the child is not valued where there's a narcissistic wound. Technically, it might be impossible to overvalue a child, by the way, but we can value them for the wrong reasons, such as valuing them for being good or being easy or being the happy child. We even describe children who don't cry as good babies. Many children experience praise and adoration for their accomplishments or giftedness and interpret that as love. In the recent Academy Award-winning movie Inside Out, the main character was referred to by her parents as our happy little girl. After several disheartening events in her life, the young girl experienced and displayed sad and morose emotions. She'd been moved, she lost all of her friends. They moved from Minnesota with her hockey team and her best friends to San Francisco, where it was very different. Subsequent to that moving, due to a lack of empathic capacity on the parents' part, her parents interpreted this morose sadness, this grief, as disrespectful. It's like when a parent says, when the child confronts me with their anger, their hurt, they're being disrespectful, rather than a valid emotional response given considering the circumstances. When we are valued for things like our talents, our intelligence, our obedience, or our happiness, especially when we are not seen by, we are not seen by others. Alice Miller, the author of the drama The Gifted Child, talked about the need to cut the connection between being admired and being loved. And this is as simple of a statement as I think is out there. Without therapy, she wrote, it is impossible for the grandiose person to cut the tragic link between admiration and love. And what I want to say about this is the greatest barrier. Think about all of us now, not just the person with MPD. All personality disorders, by the way, are the one thing that's consistent about them is that the pattern has become so solidified that it's really hard to treat. But the biggest barrier for all of us, for you, for your children, for your spouses, for everybody you know, the biggest barrier for addressing this narcissistic wounding is success. Is the fact that you can accomplish all of those things. I think I've told the story where my therapist included in a book a reference to me, and she said, she was writing about something else, but she said, due to his narcissistic gifts, he's able to accomplish a lot. And she went on to talk about me for a sentence or two. The point of the story is the narcissistic gifts are the things that I developed to earn affection, love, the limelight, the spotlight. Without therapy, it's impossible for the grandiose person to cut the tragic link between admiration and love. And most people will never look at that until they fail. They might achieve success in business or the arts or some area of life, but until it stops working for them, it's going to be hard for them to unravel this. Because what's underneath it is an absolutely terrified, insecure child. Alice Miller said, parents also have to be able to tolerate their children's disappointment, resentment, and even anger when their wishes aren't granted, when they are pushed to work out problems on their own, or when they are frustrated. A routine theme among parents of distressed teens is their inability to tolerate their children's unhappiness. Melanie Klein, who's a part of creating object relations, a psychological theory, talked about two positions that human beings take throughout their development. The paranoid position is the early life experience. The badness, the enemy is out there. The problem is out there. The reason I'm unhappy is because of the state of the world, because of the political nature of the world, because of global warming, because my child is struggling with substance use disorder, because my spouse is a raving codependent. The problem that makes me unhappy is something outside of me. The child, the identified patient, the spouse, co-parent, the ex-spouses are favorites for folks to project their own stuff onto. And in essence, it's the other. Then the depressed position, which some people arrive at and some people don't. Sounds negative, but it isn't. Is to realize the problem is me. But the best thing I can tell any of you, I said this to somebody today, you're the problem, but you're also the solution. And so if you want to know kind of an idea, a way to think about your own work, it is to say, how am I the cause of my own problems? And how am I the solution to my own problem? How has who I have become up to this point to survive, to make it through life, how has that person that I've become, as the analysts say, my greatest obstacle in finding what I want out of life? So the depressed position is to realize the problem is in me, to integrate. It's a sign of mental health, a sign of empowerment. I wrote in The Audacity to Be You, there are two primary courses we take when we encounter someone who seems different or so much more depraved than us. First, we find out what is in common between us. We find it because we have the courage to look deeply inside of ourselves and realize that there are fewer differences than we imagined or that we hoped for. The second course, through this problem, this issue, is to turn the other person into a monster. This requires very little capacity. We turn our hurt and our fear into anger and hate. So one of the things you can look for in yourself, and you can see it in others too, although it's not as helpful to see it in others, because it's always easier to see in others the faults and flaws that we have in ourselves. One kind of tool or trick is to listen for judgments. Judgments are a sign of a lack of integration. Judgments are a sign of narcissistic wounding. Judgments are a sign that we believed in ourselves and in other people that you had to be good, to be loved, to be worthy, to exist even. A recent notion from pop psychology is that previous generations of children worry about what the parents thought about them. But this generation, it's said, parents worry about what their children think about them. If we take this to be true, then it is the same person in each generation that is doing the worrying. In other words, children who are raised to worry about what others think, parents included, fail to develop a whole sense of self. They are wired to believe that what others think about them is about them. So the child who starts off as a parent pleaser grows up to be a people pleaser and then grows up to be a child pleaser. The child grows up to be an anxious parent, tossed about by the whims and emotions of their own children, asking our children to give us the reassurance, the sense of self that we ideally should have got from our parents. Some uncommon thoughts. Narcissism doesn't come from indulgence. Although the indulgence can be a signal that the parent is trying to soothe their own narcissistic wounding. I have to get my child to love me because I don't love myself. Because the only way I can be worthy is if the mirror in front of me is reflecting back my goodness. It doesn't come from being too permissive, although again, that can be a signal of a deeper dynamic at play. Anxiousness in parenting is often present. Parents all like to talk about being well-intended. But again, well-intended has a judgment to it. In this way that I'm talking, there's no good or bad intentions. They're just intentions. The link between worth, value, and our accomplishments is, when we talk about, that's why I'm so reluctant to talk about being proud of my children. Because proud of my children tends to point back to me. It's about me. It's how you hold the child in your mind. And ultimately that comes from how you hold yourself in your mind. So the cure to all of this is you doing your work on your narcissistic wounding. To see your own narcissistic patterns. In other words, the patterns where you don't feel good enough. Virtually everybody I know who talks about self-help and psychology and therapy talks about this idea about at times not feeling good enough. So that idea goes back to the narcissistic wound. It's born out of an attachment fracture or a trauma where the child is left alone. Narcissism masks or covers up dread and fear. And isn't that obvious when we talk about it? If somebody was okay with their humanness, they'd be okay with failing. They'll be okay with mistakes. They would say, I'm sorry, easy. They could listen at length to their loved ones' complaints about them. And again, cutting the narcissist down to size, making them feel small, isn't the solution. It's part of the symptom. My therapist wrote in her book about the misery of the good, it's called The Misery of the Good Child, which is very similar to the drama of the gifted child. She said, of course, the good kid is never the real kid either. The only real kid is the whole kid. Good parts, bad parts, and those in between. From the drama The Gifted Child, this is adapted. For one is free from narcissism only when self-esteem is based on the authenticity of one's own feelings and not on the possession of certain qualities. And like I said, without therapy, it's impossible for the grandiose person to cut the tragic link between admiration and love. And Alice Miller goes on to say, the grandiose person is never really free. First, because he is excessively dependent on admiration from others, and second, because his self-respect is dependent on qualities, functions, and achievements that can suddenly fail. And all of us can relate to that just a little bit, can't we? So, and the goal is to find our true self. We have to mourn. We have to grieve. Miller says this is not a homecoming, since this home has never before existed. It is the creation of a home. The child must adapt to ensure the illusion of love, care, and kindness, but the adult does not need this illusion anymore to survive. Probably the greatest of wounds, not to have been loved just as one truly was, cannot heal without this work of mourning and grief. And when we realize all of our lives that what we have feared and struggled to ward off something that can really not happen any longer, it has already happened at the very beginning of our lives when we are completely dependent. I love that. We then realize that all of our lives, we have feared and struggled to ward off something that cannot really happen any longer. It has already happened at the very beginning of our lives while we were completely dependent. I wrote once and posted it on social media, I said, most parents gaslight their children on a consistent basis. Regretfully, I have done it more than I would like to admit. And yes, it is a symptom of parental narcissism. And the response that I got back from others was at times volatile. People tell me that only narcissists gaslight. They have to be an NPD, qualify for NPD. But there are continuums and gradations of it. We love to create distance between us and the truly disturbed. Again, the badness must be out there. In a sense, mental health can be a measure of your ability to hold the badness inside of yourself, to metabolize it due to the greater experience and consciousness that you have, that you've developed, often in concert and in tandem and working with a therapist, and then to breathe out into the world love. Most people think that gaslighting is a conscious manipulation. It's not necessarily true. We're not talking about a sociopath. We're talking about the fact that the defense, the gaslighting is just that it can't be me. So every defense has some gaslighting in it. Sometimes it seems to be an intellectual block that people just don't get it. But again, we call this a kind of pseudo-stupidity. It's not really a cognitive error. It's not that the person doesn't get it. It's that the client, the person who's suffering, will be in so many ways the last to know. Most parents, I've heard, are securely attached. Around 56 to 60% is what the general research suggests. They're able to provide their children with a secure attachment. I think it's a lot less than that, especially when we talk about the continuum. Some people think you're just talking about treatment parents. That's not my experience at all either. These are not just people that are in the mental health space seeking treatment. In fact, in my experience, most people avoid treatment because they're still, the narcissistic wound has them. So I love this idea adapted from the drama The Gifted Child. The therapist may cloak their disapproval and derision behind abstract terms like borderline, obsessive, regression, destructive. But unless they explore the 3-year-old child inside of themselves, they will not see the parallel between these garden variety terms and contempt. The solution, the cure, resonating, understanding, connection, and long-term psychotherapy is often the only way to heal. And again, that usually comes after a failure. Some part of their life did not fare well with this adaptation. If we want to be helpful, we will practice compassion, born out of the insight that I've discussed here, which includes the fact that we all have some of this. We'll refrain from hate and name-calling towards the narcissists or the generations that came before them. We'll stop judging these people and start helping and teaching them. We'll teach them about patterns that I've described in this broadcast. And we'll be patient when they struggle to grasp them, because we will know that their wounds and their symptoms came to them honestly. Perhaps the most important point is that we will be patient with others, because we will know that we too need that same patience. We will know this because we have gone into the dark corners of our own psyches and recognize that our demons share so much with the ones that we see in others. Narcissism is not a binary. That is, it's not that one is or isn't narcissistic. The way I talk about it is a continuum that we are all on. Your romantic relationship isn't the first narcissist that you've dealt with. Our earliest contexts had narcissists and gaslighting, which is why we have a hard time identifying them in romantic relationships later in life in the early stages. Narcissism is the result of the narcissistic wound, the wound of not being seen. Or you can think of it like objectification, being valued for qualities, being pretty, handsome, smart, talented, etc., rather than being valued for one's inherent being. Codependent people often identify with boundaries as selfish, self-centered, and uncaring, and mistake them for narcissists. Narcissists can be malignant and grandiose, that's the classic type, or they can be depressed, vulnerable, and covert. When we're able to sit with an empathic other, like an adequate therapist, we come to know ourselves and are able to hold boundaries and to sit in our truth. So the sum is, we all have some. And the sooner we own it, the sooner we'll be released from it. And the greatest work that you can do for your marriage, for your romantic relationship, and for your children is to look at your own narcissistic wounding. To embark on the path of healing it. Do the work of figuring out who you are, who is your authentic self, before the world told you who to be. It's not about betraying your parents or your grandparents or blame. It's about looking back to understand ourselves. And if you want to teach the narcissistically wounded person most effectively, model it for them. Be wrong. Be bad. Willingly. Generously. Authentically. It's not a simple cause and effect relationship. It's complex, it's nuanced. We can talk about the dynamics without talking about them in terms of causes. We can talk about them in terms of contributions, dynamics, or even more poetically, the air we breathe, the soup that we were cooked in. The subtitle of the Audacity Be You is what I'm talking about here. It is learning to love your horrible, rotten self, or in other words, the parts of yourself that you have been taught are horrible, which aren't. I hope that helps. If you want to do a deep dive into this, Finding You Intensive is that opportunity. August 5th through 9th is the next available slot if you want to sign up. September 9th after that. I will be doing a couples Finding You Intensive in November. So go to our website, email us at info@findingyouprograms.com to learn more. For all other private inquiries and intensives, feedback, if you want to attend our support group, which is on the third Wednesday of each month, the next one being July 15th, contact us through our website or email us at our email address, info@findingyouprograms.com. We can also help you find a coach or a therapist that can help you work with this. If you want to do a week-long workshop, I'll be in Rhinebeck, New York at the Omega Institute. Beautiful setting in the Hudson Valley with my daughter Emma, teaching the class on the Audacity Be You, learning to love your horrible, rotten self. For more, go to eomega.org, click on the workshop tab, and then click on the Audacity Be You. We'll be teaching and facilitating the same workshop in Boone, North Carolina in the fall, September 27th through October 2nd at the Art of Living Retreat Center. Go to artoflivingretreatcenter.org to sign up and learn more. My 3 books, The Journey of the Heroic Parent, The Audacity Be You, and my new co-authored book, Stay in the Room, are available on Amazon and Audible. Actually, the Audible book for the third one is coming soon. And again, I'm going to be back on Thursday night. I lied last week to you and told you I'd be back, and I wasn't back. I will be back this Thursday, barring an emergency, to do another Ask Me Anything episode. Please send in any questions, any suggestions. I'm much more inspired when I can feel what the audience wants, what they need, and what they're curious about. So send me anything to our email address, info@findingyouprograms.com. If you are an Inner Circle member, you'll get the invitation. You can attend live and ask the questions live also. All right, folks, that'll be this Thursday, July 2nd at 6 p.m. Mountain Time. So I'll see you then. Ask Me Anything episode. I hope this is a helpful point of contact. I hope it engenders more compassion toward ourselves and towards others. And as always, for and on behalf of the people that you love and the people that love you, thanks for showing up to these, for listening, for doing this kind of self-inquiry, because You doing your work makes all the difference in the world. Have a great evening, and I'll talk to you Thursday night. Take care. Bye bye.